Hello everyone. So today's topic of discussion is how pimples are formed on your skin and how exactly the anti-pimple creams work. Now whenever you go to a dermatologist, the two category of anti-pimple creams prescribed to you are one, antibiotics, and the second, retinoids. Now to understand how both these categories of medicine work, we need to first know the three-step procedure how the pimples are formed on your skin. Now the very first, you should know that there are lots of oil glands on your skin. Now when they start producing oil, they release the oil from the opening on the skin surface. Now this oil hydrates your skin, but due to some or the other reasons, if these oil glands opening on the skin gets clogged, they get blocked, so all the oil will not be released on the surface. Instead, it will get accumulated under the skin. Now, when lots of oil gets accumulated under the skin, it attracts lots of bacteria to feed upon it because it's a food for the bacteria. You can understand it if any sweet falls on the ground, you suddenly see the ants running towards it because ants want to feed on that sweet. Similarly, when lots of oil gets accumulated beneath the skin, the bacteria gets attracted to it. So lots of bacteria comes there. And third step, the bacteria releases certain substances which will lead to swelling and inflammation, which you see as pimples. So the very first, the oil glands opening gets clogged. The second step, the excessive oil gets accumulated beneath the skin. The third step, the bacteria comes, releases some substances which cause redness and swelling, which you see as pimples. Now, when retinoids and antibiotics are given, what does antibiotic do? It kills that excessive bacteria which gets accumulated under the skin. Secondly, what does retinoids do? Retinoids work on the first and the second step, that is by removing the superficial dead accumulated skin, they unclog the clogged pores. They unblock the clogged openings of the oil glands. Secondly, by getting inside the oil glands, they reduce the oil production. So retinoids work on unclogging the clogged pores, and secondly, in reducing the oil production. The antibiotics, they kill the bacteria. So combination of antibiotics and retinoids works best to treat your pimples. Now, whether the antibiotics and retinoids are given in the cream form or oral form depends upon the severity of your pimples. In case you come with a very mild case of pimples, I'll just give you, or any other dermatologist will give you only the cream form of retinoids and antibiotics. But in case you have moderate to severe pimples, then of course the oral antibiotics and the oral retinoids would be given. Now, what type of antibiotics and retinoids? To be more specific, when you come for the topical creams, so two types of antibiotics are given. One is benzoyl peroxide or clindamycin. When it comes to topical creams of retinoids, either adapalene or tretinoin are given. When it comes to the oral form, in antibiotics, either doxycycline or azithromycin is given, or in retinoids, isotretinoin is given. So these are the various types of antibiotics and retinoids which are given to you in combination for treating your pimples in cream and oral form. Now there are so many do's and don'ts which you need to take care when you are using these medicines. So I always say these videos are only for the educational purpose, so that you know how pimples are formed, how the medicines are working, what's happening to your skin, but they do not make you a doctor. They do not allow you, to just do the self-medication. Now you know that antibiotics and retinoids have to be given, so you should not start your own self-medications. Like if I tell you for retinoids, whenever we give oral retinoids to a women, we always tell that if I'm giving you for 3 months, you should not plan pregnancy at all. So these are the few things. When I'm giving you retinoids for cream form, I always tell you to use half a drop on the half the cheek. If you use more than that, it can cause redness and peeling. So there are so many do's and don'ts which a dermatologist can tell you by seeing your skin and condition and other things. Everything can't be told on the YouTube videos. So please, these videos are only for informative purpose, not to make you a self-doctor, not to encourage you to do self-medications. You should just know that a retinoid and antibiotic combination would work wonderfully well in case you have pimples. If you want early relief of pimples, apart from antibiotics and retinoids, the salicylic and glycolic acid peels can also be done on your face. So 5 sessions are recommended every 10 days. It takes 15 minutes per session. Immediately after that, you can go back home. What's happening is when we apply the salicylic acid peel on your face, the salicylic acid gets inside your oil glands, reduces the oil production, kills the bacteria, and unclogs the blocked oil glands by removing the dead skin. So that's how salicylic acid and glycolic acid peels are working. They are very safe and they help you get rid of the pimples in an early stage. Suppose if you have your marriage coming or an important job interview coming and you want a quick result, you can go for salicylic acid peels. Another benefit of treating your pimples early is the fact that more the time you give your pimple, more the time you have given it to destroy your skin, so more the chances that it will leave the scar or a mark. If you treat your pimples early, there are very less chances that it will leave a scar or a mark. So that's why whenever you get a pimples, you should not delay its treatment. Just consult your dermatologist. Either go for the oral or the topical retinoids or antibiotics, or go for salicylic acid peels and glycolic acid peels, so that you can shoo away your pimples early so that they don't leave marks and scars. Do subscribe my channel by the name Dr. Anvika, YouTube channel Dr. Anvika, Instagram and Facebook also by the name Dr. Anvika. And in case you want me to make videos on any particular topic, do comment in the comment box below and I'll try to make the videos. Stay happy, stay beautiful, and we'll meet you in the next video.